Hi everyone, my name is Sarah Wright and today is August 1st, 2022 and I am not using any flashcards. Today I'm going to be focused on the urinary system. So the medical specialty that focuses on the study, diagnosis, and treatment of the urinary system or tract is going to be referred to as urology. And then the medical doctors or healthcare professionals that focus on the urinary system are going to be referred to as urologists. And then any surgeries that are on the urinary system may be referred to as urology or also called genitourinary surgeries. So the main reason why I chose this system is because it personally affects me and my disease that I have. In addition, through my own research for my personal gain, I have found that the urinary system is often ignored. Not completely, obviously, but I find that a lot of times when it comes to medical research, it's not really focused on, and a lot of times that leads to a lot of unknowns surrounding some certain diseases in the bladder or the urinary system in general. So that's why it interests me. Also, I really am fascinated with how urine's even made. Just by doing this assignment, I've found that it's just really interesting for me. So the main organs that make up the urinary system are going to be the kidneys, which are going to take urea as well as waste byproducts or substances and form urine. And then that urine is going to be drained by ureters into the bladder. And then the bladder is going to store that urine until elimination. And then at time of elimination, it will go into the urethra, which will take that urine and exit out of the body. The organ I chose to focus on is the bladder, which anatomically speaking is located at the anterior half of the pelvis, and then the posterior to the reproductive organs, and then inferior to the peritoneum. The 5 anatomical landmarks of the bladder are going to be the apex, which is also called the dome, and that's going to be the antero-superior portion of the bladder that's going to point towards the abdominal wall. And then we have the base, which can be also called the fundus, which is going to be that postero-inferior portion of the bladder. And then we have the body, which is behind the apex and fundus, or behind the base and the dome. And then we have the neck, which is the constricted part of the bladder that goes to the urethra. It is also called the trigone, which is essentially tissue that's going to help protect any backflow of urine, which if there is any backflow can definitely cause infection or any cause inflammation and things of that nature. It's not good. In the trigone, there's also a right and left lateral wall. And then, as mentioned somewhat previously, the main function of the bladder is going to be as a storage vessel for urine that is produced by the kidneys. So, thank you.